Hello and welcome to the Different Strokes exercise programme. My name is John Graham. I'm the Clinical Director of Physiofunction, one of the UK's leading providers of independent outpatient stroke rehabilitation. I've worked with Different Strokes as an expert physiotherapy advisor for over 20 years. I've devised the classification system for this programme so that you can identify the level that matches your current abilities. Exercising at the correct level will allow you to benefit from exercising regularly at home whilst ensuring your safety at all times. I wish you every success with the programme. Before you begin any exercise programme or begin to follow any of the training recommendations, advice or other instructions, you should first consult your doctor and have a physical examination. The recommendations, advice and instructions provided by Different Strokes and the instructors leading these exercise sessions are in no way intended to replace or to be construed as medical advice. Build up slowly. Start with 1 to 2 sessions a week, gradually increase to 3 to 5 sessions a week. This is your level 1 session with Matt. Level 1 sessions are designed for people who are unable to move their affected arm or leg. All the exercises are done whilst you're seated in your wheelchair or a sturdy armchair. No standing is required to perform any of the exercises. For your own safety and to gain the maximum benefit, you'll need to ensure that you have a carer or a family member available to assist you during the class.
Hi everyone from Different Strokes, I'm Matt and this is your level 1 session number 4, focusing on core and flexibility. You need one piece of equipment for today's session, either a ball, could be big or small, or as an alternative you could use a cushion. Okay. Please take a moment to read through the guidance attached to your workout program, and assistance, please support where you can with the affected side. So we're going to start with a dynamic warm-up. So this is flexibility but working on our muscles through movement. We'll do our core part in the middle, and then towards the end of the session we'll do our flexibility to try and develop the muscles. So let's get started with our upper body dynamic warm-up. Take your non-affected hand onto your affected side wrist, support from assistance if required, and just gently reach forwards and back to the chest. So arms out and back. That's great. Keep that going. So on these movements, we'll be working roughly 60 seconds. These exercises are good for circulation and also your range of movement. Okay, very good. Now raise your arms up and down. So keep your hands quite close to the chin as you raise up, and that may help you increase your range of movement. That's good, just keep it going. So working at a tempo that you're comfortable with, just take your time. Okay, good. And then rotate gently side to side. So a bit of core involved in this one already. That's good, everybody. Just keep going at your nice, comfortable tempo. You could try rotating around a bit further now, maybe, working through that range of movement. Okay, we'll go non-affected side only now. Take the arm back behind you and then raise up. I'll show you from this arm, show you what we're doing. So arm back and then forwards, arm back and forwards. So keep that going with your non-affected arm that you're able to do. Good, and now swap to the other arm with our assistance, please, just to help gently bring the arm down to the hip and forwards. So just gently down and then raising out in front. Okay, good. Back to your non-affected side. We're going to raise the arm out to the side and up as high as you can, and then back down again. So arm going out to the side and then up. Okay, very good. And then to the other side, support again from our assistants, please. Raising the arm out and down. Don't worry about going up from the shoulder unless the range of movement is there, but just gently out to the side and down to the hip again. Okay, very good. Bring your knees apart, hands together again, and we're going to lean forwards, reaching down towards the floor. So gently lean forwards and slowly pull your shoulders up and back again. That's good. So again, lean forwards and then pull yourselves back. Okay, well done. And now we're going to lean over the knees. We'll turn it side. So keep the knees out to the side, hands together again, reach over the left knee and then over the right knee. So just gently keep doing that, pushing over across side to side. Okay, very good, well done. Onto these legs now then. So let's go alternate sides. So assistants, if you could please kindly just help support and raise in the affected side leg by holding the ankle and then a hand underneath the knee, just to gently raise up and down within range of movement. So knees up and down. So marching on the spot, keep it going. Good, and then kicking the legs forward. So if you're non-affected, big strong push out, and then assistance please, hand underneath the ankle just to gently help that leg raise forwards, and then back again. If you wanted to do that independently, which you can, is to tuck your non-affected ankle underneath the affected side. You can push both legs out together, and then back again. Okay, keep it going. Okay, good. Well done, everyone. Take a pause there. Okay, just take a moment to recover. Get your breath back if that has made you slightly breathless. And then also find your object that we're going to use for our core exercise. So a ball or similar object. Okay. And of course, you can take your drinks whenever you wish. So the first core exercise we're going to do is to hug the ball into your chest. So you can do that with your non-affected arm if you wish, or you can do it with both arms together by having your affected arm tucked underneath your non-affected, holding the ball, hugging it in nice and tight to your chest. Okay. First exercise we're going to do is ideally we want to be away from the back of the chair ever so slightly. So there's a gap to our back to the back of the chair. And what we're going to do is we're going to gently lean forwards, tucking the ball down towards our knees. And then we're going to lift with our shoulders and gently roll back for our back to touch the chair. So away we go, just nicely, slowly controlled. Lean forwards, lean back, and just keep hugging that ball in tight to your chest. That's just to keep the upper body nice and strong and upright while we're squeezing and working through that core. That's good. Keep it going. So 15 seconds more, just working by time again, doing the reps that you can in that time. There's no rush, no speed needed to these. It's just good movement. And then pause there. Good, have a little rest, or if that means sitting upright or taking a rest back into your chair, that's fine. We're going to do that for a second set in just a moment. Okay, so come back to that position again. Try and sit yourselves up nice and tall, away from the back of your chair. And again, maintain that squeeze into the chest of the ball, lean forwards, and then roll back. That's it. So we're not curling the back at all. We're not arching down or arching back. Keep that ball squeezed into the chest, lean forwards, and lean back. Just don't try not to arch your back. Very good. Keep it going. Okay, good. Just over 10 more seconds. Nice and steady. Okay, good. Ease off again. Take a rest. Well done, everybody. Okay, so the next movement we're going to do is a rotation. Okay, we're going to take the ball across our body, side to side. Again, affected arm, assistance. You may well require your help for this one to try and keep that affected hand on the ball. So just the palm over the palm would be supportive. Otherwise, you could try and hold in the ball with both hands. Maybe tuck your hand underneath your ball or cushion, whatever your object is, to hold both together. Either way, what we're going to do is go back to our rotation, similar to what we did in our dynamic movement warm-up. So holding the ball though, and we're just going to raise it to the side, reach your arms out as far as you can, and to the other side. If you find more benefit doing it without using your affected arm, that's fine too. So you can just use your non-affected and reach across side to side, working those core muscles in your waist. Let's start that in 3, 2, 1. I'll do the first one both together. Okay, pause there, well done. Take your short rest, and then we'll be in for a second set of exercises. Okay, here we go then. So this time I'll do it with just the non-affected. Follow along how you wish. Get a bit more range of movement most probably. Okay, and pause there again. Well done, everyone. Good, good. Take a short rest. We'll do one more core exercise for a couple of sets. So what we're going to do on the last one, we'll have our knees apart, and we're going to take the ball down towards the floor and then raise it up as high as we can through one movement, okay? So if you're non-affected hand, it would look like this, leaning down towards the floor, and then raise up. So you're going all the way down, all the way up, okay? Both together, okay? One hand over the other or under, however you wish, down and raise as high as you're able to, working your range of movement. Assistance, maybe with this one, we can support when we get to about here, so hand under the affected elbow, just to help the arm raise up would be perfect. Okay, so let's give that one a go, everyone. Nice and gentle. Reach down to reach up. Okay, take a short rest there. Well done. We'll do that for one more set. Okay, away you go. Down and up. Okay, 15 more seconds. Keep going, everyone. Really good work. Okay, well done. Relax there. And we'll be done with our object now. Let's kick that away. And then we're going to go on to our static flexibility movements. So this is where we aim to develop flexibility through the muscles. We'll start with the lower body and then work our way up. Okay, so the first muscle we're going to look at is the calves, the back of the lower leg. And the way we're going to stretch that one, we'll do these both legs together for this one. So if we can get both those legs out in front with your toes pointing up, okay. We may need assistance if you can just gently help pull the toes back, okay. But what we're going to do is lean forwards. Doesn't matter if the knees are bent on this one, that's fine. Lean forwards, reach your toe and just gently pull it back towards you. So on the affected side, assistance, if you just gently pull the toe back towards the shin. Stretching our calves. We want to be holding these sort of stretches for 30 seconds, ideally, or more. Just really develop the flexibility in the muscle. You may find as well after 15, 20 seconds that you can pull it in a bit more. So hold that stretch. That's good. Let's hold it for 10 more seconds. 3, 2, 1. And then ease off, relax those calves. Well done. The next one we'll do single leg. So come back to one leg bent. The other leg we want to be nice and straight this time. So before the calf one, we could have a bend in the knee and pull the toe back. This one we're having a straight leg. And then we're reaching our hand down the shin. Away you go now and hold that. So this is our hamstring, back of the leg. Stretch. So again, with this one, you may be able to reach a bit lower down after a bit of easing off. That's good. Keep holding it there. And then gently come up and release. Well done. And assistants can support us to raise the leg forwards on the other side. Still use your non-affected arm, hand to reach down and across on this one. You can take both hands down together if you wish. Get a bonus stretch on the affected side. Holding that there, well done. Five more seconds on this stretch. 4, 3, 2, and 1. Good. Up you come. Very good. Well done. There is a stretch. We won't do this one. There is a stretch that you can do. It is limited to those of you that can bring your heel back between your chair. If you are in a chair with a back against it, maybe a sofa, or I know some wheelchairs don't allow you to push your legs through and back. This one is a bit hard for you to do, but you could, for the sake of the thighs, the quads, is take the toes back under your chair. But the one we're going to do is raising the knee up with a bent knee. Okay, so lift your knee and hold it just there. Okay, good. And then repeat on the other side. Use your non-affected hand to pull that knee. You may need our assistance to help with the hand under the leg, or you may be able to do it yourself. Okay, very good, well done. So we do these upper body stretches, first few, both hands together. So hold the wrist on that affected side and push both arms out in front. Hold it there. Push in away from you. You can even tuck your chin down to feel a stretch on the back of the neck at the same time. Good, lift your head up, all the way up, and take the arms up too. Always makes me yawn, that one. Good, relax the arms down. So back to single arm, take the arm across your body, hold onto your shoulder. There's your non-affected arm across the body, holding onto your shoulder. Okay, good. And then take your affected arm across the body to the other side with assistance from yourself. Pulling the arm over. And then relax. Very good. With your non-affected arm, we're going to take the hand up and to the back of the head, or even to your upper back for your tricep stretch. Hold it there. And gently release. Good. Take your affected arm and just raise as high as you can. Maybe even push from the elbow if you're able to. And then relax down there. Good. Take both arms together once more and rotate and look over one shoulder. Hold it there. Good. And then go back the other way. Rotate and hold it there. This is the last one today. And then come back looking forwards. And fantastic. Well done for today's session. Done really well. And we'll be continuing with our next session, working back to movement and mobility. Look forward to seeing you for that one. But really well done for your core and flexibility today.